Our inpatient occupancy in the province's large hospitals is at 102%.
Okay, 102%, that is not okay. Here we are in the middle of January and the government finally called a press conference to talk about the crisis in our hospitals. I hope he's going to have a plan, but I thought let's watch it together and let's analyze a little bit about what he has to say.
The reason we didn't call a state of emergency is because we have all tools and authority necessary to manage the system, as we have been in collaboration with our agencies and service providers.
So one minister showed up with 4 CEOs. The minister seems to say that everything's fine, that he has all the tools he needs, that there isn't an emergency. It definitely doesn't feel that way to the doctors. About 300 of them have signed on to a letter saying that it is a crisis.
I will fully acknowledge that we should have more acute care capacity in the Edmonton area than we do today, which ultimately, yes, I am accountable. And yes, I believe that there could have been greater capacity built in the years and decades, frankly, prior to today.
Do you know when the last hospital was built in Edmonton? The last community hospital? 1989. That's longer than Taylor Swift has been alive. Yeah, acute care capacity. You know what we need? A South Edmonton hospital. That was something that the NDP announced when we were in government. We secured the land. We started out all the planning, invested millions of dollars in the construction of it. Then the UCP came in, put it on pause for a long time, and then finally they just admitted that they were never going to build it and they canceled it. So that would be helpful acute care capacity. So would the children and adolescent mental health hospital that was supposed to be built next door to the Glenrose Hospital. All of that would have freed up more space in our existing hospitals, but it's been since the 1980s since Edmonton got a new community hospital. That's not okay, and the government still hasn't actually committed to building a new community hospital.
Our inpatient occupancy in the province's large hospitals is at 102%.
Okay, 102%, that is not okay. Our largest hospitals are over capacity. That means 102% means that there's people in the hallways. We all know that. We've seen pictures, we've heard the stories, but it's not okay. And just standing up saying, hey, we're just at 102%, like, no, that is crisis. And if that's not crisis, what is?
There is no one person who runs a $28 billion complex integrated healthcare system.
Okay. You know, in every other province, there's like one health minister, but she has 4 health ministers. You think that that might lead to 4 times as many people being available to answer questions, to take responsibility. But no, we haven't heard from a single health minister for almost a month. It's been almost a month since any single one of them stood up. And now this guy's standing up saying no one person's in charge. Well, the premier's in charge and he's supposed to be her right hand.
But you did not see mass surgical cancellations or sites closing. And that is a credit to frontline healthcare workers.
Well, I agree with that. Frontline healthcare workers are working beyond capacity. They are exhausted. They are frustrated. They're asking for help. And just acknowledging that they're working harder than they should isn't enough to actually give them hope. I've never seen morale worse than it is right now. And what they actually deserve is a government that's going to step up and give them more help. The crisis we're in right now has been ongoing for about a year. Edmonton's been on diversion, now Calgary too, for months and months and months, and this isn't going away. What we actually deserve are long-term solutions and leadership and accountability. And I can tell you that if I was the minister today, I'd be updating Naheed at the beginning of the day and the end of the day on what we're doing to make the system better, what we're doing to make sure that we lessen wait times in emergency departments. I'd be meeting with those 300 plus doctors who signed on to that letter saying that they're in crisis and that they need help to get their solutions. I'd be funneling the right resources into the front lines to increase capacity today, surge capacity, but also I would have built the South Edmonton Hospital, and I'd make sure that we have more opportunities for everyone to get the care when and where they need it. And the other piece, family doctors. We have almost 1 million Albertans without a family doctor, and this government isn't doing anything to help address that issue. But the more we can keep people well in community, getting their measles vaccines, getting their flu vaccines, keeping them out of the emergency department, the better. And we also need to build these desperately needed new hospital space in the healthcare system. So better is absolutely possible. We're going to keep proposing it, and we're going to keep holding the current government accountable.